Greetings, dear friends. I am Dr. Artem Park. There are many causes of erectile dysfunction. There are a huge number of them, but there is one that is the most common, the most widespread, and it's the one my patients come to me with most often. Friends, today we will do an exercise to get rid of this problem. And if you are a man and have this kind of issue, please use it. If you are a woman, please send this video to your loved ones, to your husbands, so that they too, because of these problems, don't have to worry or suffer from them. For an erection to occur properly, adequately, and in a timely manner, high-quality innervation is very important. And the nerve that is responsible for this whole process is called the pudendal nerve. In other words, if the impulses along this nerve don't travel well, an erection either won't happen at all or will be incomplete. This nerve passes under a muscle called the piriformis. The piriformis muscle is located in the middle of the gluteal region, extends from the sacrum to the side, and attaches to the femur. We will need to work with this muscle. If trigger points form there, if the muscle is tense, if it is shortened, it increases in volume. As a result, it compresses the pudendal nerve. This disrupts the nerve impulses and leads to erectile dysfunction. In addition, all the muscles of the gluteal region have a background influence on the piriformis muscle. If there is tension there, most of the load falls on the piriformis muscle, and trigger points will accumulate in it much faster. Therefore, together with the entire gluteal region, we definitely need to work on it. Maybe you heard as a child, don't sit on cold surfaces or you'll have problems with potency. Friends, in reality, it's not just the direct effect of cold that matters, but also the indirect impact on the muscles. We know that when exposed to low temperatures, muscles start to contract. You might have noticed that when we go out into the cold, we immediately start to tense up a lot, really tightening our muscles. The same thing happens with the gluteal muscles and the piriformis muscle. If a person already has even a slight tension in the piriformis muscle, if there's a predisposition for the pudendal nerve to be compressed, and then they sit on something cold, the muscles will contract even more, and after that, they might notice sexual dysfunction. That's why, friends, it's important not only to avoid sitting on cold surfaces, that's a basic recommendation, but also to restore your muscles, so that even if you happen to sit on a cold bench or a cold stone somewhere, nothing bad will happen to you, so that the nerve is free and impulses can travel through it properly. So, the first exercise. We need to thoroughly work on the attachment points of the gluteal muscles. This means the gluteus maximus and the piriformis muscles at the sacrum. Here, the person is standing with their back to us. Take note, here's the sacrum. We need to knead along this entire line. We'll even partially go over the iliac bone. So what do? We take a ball and place it on the lateral surface of the sacrum. Here it is, just 3 points. 1, 2, 3. And we'll perform a left to right movement, rolling the ball. So I place the ball at the top point, right here, pressing it against the wall. Our legs are slightly bent at the knees and slightly bent at the hip joints for stability. We press down on the ball, and we make movements like this. Right now, the ball is positioned here for me. Friends, I hold the ball like this with my hand, or just keep my hand there. I keep it nearby so that if it slips out, I can catch it right away. That's why we always keep our hand near the ball for control. Alright, now we do these rolling movements to the left and right. Please do 20 repetitions, meaning 20 rolling movements. Then I move the ball to the middle point. I also press it down, do rolling movements, then move the ball lower, closer to the tailbone, and accordingly perform the same movements. Left and right for 1 minute. We need to work on one side for 1 minute, then work on the other side. And by the way, friends, if during the self-massage you find the most painful, most tense trigger point, you can work on it longer. You can even just squeeze it, press it down, and apply static pressure for another minute. But usually about 1 minute of kneading is enough, if there are any tags somewhere. Another minute of static pressure is enough for both sides. And in this way, we work through the attachment of the gluteal muscles. Our second exercise is aimed at working on this area. The attachment of the gluteus maximus and the gluteus medius to the iliac crest is also partially involved. In this area, where injections are given in the upper outer quadrant, we partially work on the gluteus minimus muscle. It's all very simple. We place the ball right here. This is the lateral surface of the pelvis. And we perform a forward-backward movement. Friends, I place the ball on the side. That is, on this side, next to the pelvis. I press myself against the wall. The back leg can be straightened, and the front leg is bent. Slightly bent at the hip, slightly at the knee. That's it. I press the ball with my hand. I can hold it a little, just to control it. I press it down and perform the forward-backward moving. You will also feel some soreness. We're working right at the edge of pain, but it's still bearable. We absolutely do not go easy on the muscles. There may also be referred symptoms going down the leg, or they might spread upward. Friends, if the muscle has been tense for a long time, then referred symptoms may appear. For 1 minute, we need it on one side with these simple movements, and then for another minute. Then on the other side. So with these two exercises, we're preparing the gluteal muscles. We're already relieving excess tension, and later on it will be much easier for us to work on the piriformis muscle. Now we're going to do this together. Starting from a seated position on the floor, we take a massage roller, place it under one glute, slightly shift our body weight to that side, and support ourselves on the floor with one hand. Friends, our task is to perform a forward and backward movement. You can also use your other hand for support on the floor, or you can rest it on your knees. At some point, you'll feel your piriformis muscle rolling over the massage roller. In this way, we're working across the muscle fibers, targeting this muscle. You can alternate as well. You can do the forward and backward movement too, right up to the edge of pain, but still tolerable. Don't go easy on the muscle. You really need to work out the muscles in the gluteal area. If you find a painful spot, you can work on it. Do these side-to-side rolls. Roll over it a few times and keep working. Then again, find another painful spot. It can be a different one this time. Do a few more rolls. So alternating movements forward, backward, and side to side like this help us really work the piriformis muscle well. 2 minutes on one side, 2 minutes on the other side. And now the final exercise. We've already done a good job warming up the gluteal muscles. Now, starting from a lying position, bend one leg at the hip and knee joint. Grab your knee with your hands and pull it toward the opposite shoulder. You'll feel a slight stretch, partly in your thigh and partly in your glute area. Friends, breathe calmly and evenly and hold this position for 1 minute. After you've stretched one side, repeat the same movement on the other side. Do this simple set of exercises to restore your gluteal muscles, relieve pressure on the pudendal nerve, and please stay healthy. If you like this routine, or if you enjoy my videos in general, please let me know in the comments. Maki and I will be happy to read them. Thank you.